North Carolina has lagged in mental health metrics for years. Youth suicides have doubled in the last decade, and resources to treat mental health have been scarce. But as WRAL's Shelley Jackson explains, some state lawmakers are trying to change that.
State lawmakers in the House filed a bill that would overhaul North Carolina's mental health system. And it was a long road to get there.
For all the people that didn't understand why we did Medicaid expansion, and a lot of us had fought it for the last 10 or 12 years, and then all of a sudden we decide that it's the thing to do.
After a decade of debate, North Carolina lawmakers voted last month to expand Medicaid in the state. Under the American Rescue Plan, North Carolina will receive an estimated extra $1.75 billion in cash for expanding Medicaid. And today, a bipartisan group of lawmakers laid out the need and how they would spend $1 billion of it.
North Carolina has approximately 300 fewer state psychiatric hospital beds available to patients because we cannot staff these beds. At the same time, on any given day in North Carolina, we have over 300 individual patients in an emergency room awaiting care.
The plan would invest in three key areas. $225 million would be allocated to improving access to behavioral health services.
Medicaid reimbursement rates for behavioral health services have not been updated in 10 years and do not reflect the actual cost of providing care, leading to fewer providers.
$200 million to building a statewide behavioral health crisis system, and $50 million for telehealth programs and a centralized bed registry. The mental health care crisis in North Carolina has forced lawmakers to work across the aisle.
We stand today before you, united before you in a bipartisan battle to combat the plague of mental illness.
And while there is still a long process for this bill to become law, they are optimistic.
This is a good day that we have $1 billion, that's with a B, to spend on mental health and substance use disorders.
This is a one-time funding bonus, and the more successful initiatives would have to secure additional funding. And of course, it has to make it through the Senate. Shelley Jackson, WRAL News, Raleigh.